Okay, are we on record now?
Yes.
Okay.
We are, okay. You use retraction cord, don't you, Pratim?
Yes.
Routinely?
Yes. Sometimes if the margin is supra G, like onlay type prep, then I don't use it. But otherwise,
And do you use laser or electrosurgery?
no, that I don't use so often.
I wouldn't do crown and bridge work without one, without electrosurgery.
Right.
Okay.
You mentioned that to me last time. Yes.
Yeah. Do they have one in your clinic?
We have a laser. Yes.
Do you know how to use it?
Yes, I use it for debridement. I use it to cut the tissue sometimes.
Just let me show you this a moment. I can't find it. Okay. You need these tips. I showed you these last time, didn't I?
I think you did not show us. Oh, yes, yes, you did.
Okay. So the one on the left there is the one for crown and bridge work. Okay.
Okay.
You run that round the sulcus just to widen the sulcus. Okay.
Okay.
And these ones, the Elman ones, you can bend them so that they, fit in the right place. This is for cutting tissue.
So can you just let me in through my computer also, please?
It costs you extra.
Sure. Thank you.
Okay. I wouldn't want to do crown bridge work without an electrode like this. Okay.
Okay.
So you run it round at this sort of angle, round the tooth. After you've done the initial early preparation. Okay.
Okay.
Any progress with making these, Eldo?
What is that?
Anand, can you translate for him?
Sorry, I didn't hear you properly, sir.
Any progress in making these?
No progress in making this. Whatever is made, it's there.
How many have you got?
I think 5 or 6 extra. Those guys are very expensive, and the main guy who was manufacturing, he passed away. His brother, the guy when we went to,
yes,
the younger one was the brilliant fellow in that. So he passed away 2 years ago, I suppose. And after that, his brother is not that brilliant as him. So he is not conforming to the specifications that we give. He is making his own changes and all that. So So the one which we made is of lesser size. For the group which I made is not of the same size. I don't know why he's making like that. He says he's not getting the pipe of this size. So he has made a smaller one, but still it's working. I tried, it's working. But it is not, it doesn't look exactly like how you have made.
Yeah. I mean, it needs to be wide bore.
Yeah.
So
It's a little bit smaller.
Because you see, you're using high velocity suction, not high vacuum.
Okay.
Ashwin, are you familiar with high velocity and high vacuum suction?
I'm not
I don't
familiar.
know the difference of that.
You don't know the difference?
No.
High velocity is what you need for restorative dentistry.
Okay.
Okay. It collects
What saliva?
Aerosols.
no, aerosol. Thank you. It collects aerosol. Okay.
Okay.
Now, if you're doing surgery in a hospital, you need high vacuum
Okay.
because there's no aerosol. They're just getting rid of blood and water and
Okay.
saline.
Okay.
Okay. So in this picture here, you need high velocity
Okay.
so that there's a very high speed of air going through.
Okay.
And the pump is a fan. Okay. It's not like a pump which produces high vacuum, high suction.
Okay.
Okay. Pratim, you probably are using high vacuum, I'm sure.
Yes.
Yeah. Okay. So we have a serious problem, Ashwin, Eldo, in finding these straws.
Yes.
Do they still make plastic ones?
But your idea is good.
What is that? Oh,
Yeah. To cut those.
saliva ejectors.
Yeah. Now, one more thing to tell you. Our assistants, they started trying those metal suction tips,
Yeah.
during surgery. They started putting it into this Piccadilly attachment. This one's. And it is working fine.
What are they putting in?
Metal suction tips into this.
I don't know how they'd fit.
It just fits. It's a kind of cold welding. It just fits because of friction. And
What are
that's
you
how they
saying?
presently work. Because
You're saying
they can,
this tube doesn't fit into it?
no, they are using metal tubes. Normal suction, metal suction tubes, which they use for oral surgery. They just tuck it into this Piccadilly and it fits there.
Why would you want to do that? Why don't you stick it straight into the suction?
No, because you can use that this thing to close the hole. If at all you require more suction, they close the hole and you get
Okay.
heavy suction.
Right.
Yeah. So I'm just thinking, I'm just advancing from that. So if this is becoming very difficult, then we can make metal tubes like this and then sterilize it and use it.
Yes. Pratim, the advantage of this Piccadilly is that if you can have the patient spit into this, and if they put their lips round that straw, the air goes through the side, through that hole in the side. Do you see the hole in the side? So it doesn't
Yes.
suck all the air out of their lungs.
Oh.
Okay. I've used those for many years.
Ashwin, are you toothpicking?
Because I was just having a sweet.
How often do you use toothpick per day, Ashwin?
I think twice, sir, twice.
Okay.
So how was it? Did you use it?
Say it again.
It's
No,
so
I was
thin.
just asking Dr. Eldo whether he was using the toothpicks.
Your toothpick is very thin
Thin.
and yeah, and very flexible.
It's breaking, is it, sir?
It's breaking.
I mean, I think
But that's
it's a
good for the
little
price.
bit of, no, but it's a little bit. But if you get used to it, I don't think so. It'll break fast. I mean, I think it's
Yeah,
just.
yeah, I'll try.
Yeah, try using it. I
Yeah.
don't think it should break fast.
How do you clean between your teeth, Eldo? Every day.
Toothpick and brush, sometimes floss.
Yeah. You're bending these okay now, are you, Ashwin?
Not exactly, sir. Actually, I'm not bending it this way.
Well, that's how it's supposed to be.
Yeah.
You're just putting one bend on, are you?
Yes.
So it digs into the patient. You need
Right.
to lie along the floor
Okay.
like this.
Yeah.
Do you cut them half? Do you have some half cut, Eldo?
No,
Why
I
do
don't
we have
have cut it.
So when they do this, aspirating at the back of the mouth, you use the long ones.
Okay.
So you cut them short like this. Do you do any occlusal equilibration, Pratim?
I have done few, yes.
So what happened to the patients with interferences?
Definitely it got better, but the problem wasn't completely eliminated because one of the crown made by previous doctor was way too high.
Yeah.
So I think they're just going to replace that one. Then it'll be better.
Mm. So you need some of these cut, Eldo.
Okay.
When you're not hanging them in the mouth, you use them like this.
Okay.
My assistant actually tucks it into the bite block, but I don't quite like it
Mm.
because then I can't.
It gets in the way.
Yeah.
Mm. Were you able to make any of these, Eldo?
I had to find a new person. They say this is the most difficult to make.
Now, do any of you have a surgical instrument catalog or an instrument catalog?
Yes.
What you do, Ashwin?
Yes, I have one company's.
Well, can you look for aspirated tips?
Oh, have it at the moment. Can I tell you by tomorrow? It's.
Yeah. I mean, I wouldn't want to work without one of these. When you're drilling on teeth in the lower. Pratim, you should have a look in your catalogs to see if there's a tongue guard saliva ejector.
Okay.
How do you retract the tongue when you're doing a crown preparation on a lower molar?
We
Assistant-
presently use the mouth mirror. Yeah.
No, you're using
Yeah.
the mouth mirror to retract the cheek.
The assistant uses the mouth mirror to retract the tongue.
We have a tongue retractors too.
You have a tongue retractor.
Yeah, the one that we use for oral surgery.
Does the patient hold it?
No, assistant holds it.
Okay. So you're doing four-handed dentistry,
Yes,
and you've got a patient who's got two hands,
yes.
but you're not using them. Okay. So if you use
Okay.
one of these, the patient holds it. See, the patient holds it like this, and you've got four hands available. Your suction looks
Okay.
like this, does it, Pratim?
Yes.
Yeah. Do you know what make it is?
What make for the tongue retractor?
The suction.
The suction, no, I don't know the make.
It is central, is it?
Yes.
Yeah. Okay. Have you got your gauze folded yet, Eldo?
He started folding it.
Okay. You've got yours folded yet, Pratim?
No. We store them in the drawer currently, but yes, I'll have her fold those.
I mean, watch this. Watch this.
Yeah, it's a lot easy. You can have as many as you want.
Yeah. Okay. And as I said to you before, I would not put a temporary crown. My assistants would not allow me to put a temporary crown or a post and core into the patient's mouth without putting gauze in.
Yeah, that I started doing it now.
Good. Good. No, you started doing it or your assistant?
Yeah, I mean, we both.
Yeah, okay. Have you looked up these, Eldo, to see if you can get some?
Yeah, I got one as a compliment. It's in one of the treatment rooms.
What are you doing about the rest of the rooms?
Yeah, I need to buy them.
Make a note. Have you got some unwaxed? Oh, you've got wax floss. You said that before, didn't you? Pratim, you got wax floss? Have
Stim
you ordered?
offers
Yes,
unwaxed
yes.
floss. Stim.
Say it again.
Stim company has unwaxed floss.
Yeah. Have you ordered some?
I have it, sir, unwaxed.
You have unwaxed.
Yes,
And do you have waxed?
I have wax also. Yeah.
Yeah, okay. You need waxed for putting rubber down between the teeth and unwaxed for checking margins.
Okay.
Anand, do you check margins with unwaxed floss?
Yes, sir.
You do. It's a cruel test. Because the unwaxed floss doesn't lie. You know, when you run it up and down, all my
What do
crowns,
you send it back to the lab, sir?
no, you trim it. You trim it. You remember the burrs for doing that?
Yeah, the green and white one.
This is the new invention.
So these are the burrs you need for adjusting the occlusion on crowns and adjusting the margin. Okay.
Cannot see, sir. Cannot see. Now I can. Yeah.
Okay. So you'd have these burrs ready to use.
My understanding was we don't touch the margins. We only adjust the contact area so it sits down, right? Because if you try to modify the margin, it will only going to get worse.
So you leave a sharp edge on.
No, but the problem is if you try to smoothen the sharp edge, then you are going to get open margin there, right?
No.
Okay.
So you're basically saying you're going to leave a sharp edge.
I mean, if prep has sharp edge, margin will have sharp edge, right? So the prep should not have sharp edge to begin with.
I think what sir is saying is about the overhanging margins, like, you know,
Okay.
the things that jump out of the finish line. The metal portion or the ceramic that jumps out of the finish line. So that'll be an overhang. So that when you floss, it's going to wear off. And in order to make it like a butt margin, to flush it with the finish line or flush it with the tooth prepped area, you know, so that for that we need to use those burrs to even it out.
Now, Pratim, if you're checking the margin with unwaxed floss like this, and it slides across the junction of the tooth and the margin smoothly, then there's no catch. Now, if it catches, this floss will spread out. What are you going to do with that?
Send it back to the lab or put there.
No, you take a burr and you smooth it. It's distressing. So, when you're fitting a crown, you put the crown onto the tooth.
Yes.
And it might be a bit tight.
Yes.
So how do you check where it's tight?
I floss through the contact area, and then I check that on the model where the contact is, and I slightly lighten the contact so it sits down all the way.
do you have the spray?
Yes, I have that occlude spray,
Yes. So that's
but
what
I don't use it that often.
you cannot tell with floss where it's contacting when you're pushing the
Okay.
crown on.
Okay.
You have to use occlude spray.
Okay.
So you've adjusted the contact point so that it's fitting down. What do you do if the contact point is open?
Send it back to the lab.
I would add porcelain on, and I put it in a furnace, and I would fuse the porcelain.
Yes.
Now, the problem with honesty is that if you can add on to contact points in your own clinic, if it's not quite right, you'll add on to the clinic, you'll add on to the contact point. If you send it back to the lab, you say, oh, well, it'll be okay. It tests your morality. So if you can add on to the contact point in your own clinic, you should do.
Yeah, we don't have the furnace though. And like I said, most of the crowns are either zirconia or Emax. So it's very difficult to add on the contact.
Is it?
But the lab is fairly good. I don't remember having any open contact. Rarely I get open margin, but not open contact.
Okay, so Pratim, you see, we put the spray on. You can see this picture here.
Yes.
And you put it in the mouth and you see a mark here.
Yes.
Now you can't check that with floss.
Correct.
As accurately as this. Okay. So you'd use that burr to smooth off the margin. Smooth off the contact. And have it smoothed off, you then want to use these to polish the contact. Have you got your polishing paste yet, Ashwin?
Not yet, sir. Not yet.
So what do? Send it back to the lab?
Some cases I use the rubber cup and move on. Some situations I give it back to the lab.
How much does that cost you?
I think roughly about 2,000 rupees. I'm not sure if I'm right.
No. You sat the patient down to fit a crown, and you've given them a fixed fee. Is that correct?
Yes.
So you got the patient in for half an hour or however long it takes for you to fit a crown.
Okay.
And you decide not to fit the crown, and you send the patient, you send the crown back to the lab.
Okay.
Right? Patient comes back again, and you you fit the crown.
Yep.
That's half an hour or an hour of your time. That's what it's cost you. You understand?
Yes.
That's the cost. Okay. And what's the cost of polishing paste?
It's roughly about 2,000, 2,500 rupees.
Yeah. I mean, how many times are you going to, you know, waste your time sending things back to the lab when you can use polishing paste? Have you got porcelain polishing paste per team?
Yeah, I found one.
You did.
We had that in the office, yes.
Hmm. I mean, this should be routine in each treatment room. Do you have them in each treatment room, Aldo? Space bar, Aldo.
Only one I have.
You see, you're testing your honesty all the time. Okay? If you've got an electrosurgery unit or a laser in each treatment room, if you need to use it, there are times when you definitely need to use it. And sometimes it would be nice if you did. If it's not in that treatment room, you're going to say, oh, well, it's, you know, it'll take me 10, 15 minutes to get it set up, so I won't use it, okay? If you don't have everything in each treatment room.
You're right. You're very right. So how do you compare between laser and electrocautery for, you know, this crown jewel? Actually, I don't find any difference in gingivectomy and all that with laser and this. This is just my feeling. I have no scientific research on this, but still I'm just thinking.
Do you know the big difference?
Really.
What do you think the biggest difference is?
There's a money factor in that.
Sorry?
Cost.
Cost.
Money and charm.
Cost.
Yeah.
Okay. I would I don't know nowadays, but if I was buying an electrosurgery unit now, it would cost about £1,000. Laser would cost £2,000 to £3,000, I think. Okay.
Also, I think those laser tips keep breaking a lot after few
really?
uses.
Really?
So the maintenance is very expensive.
Yeah.
Oh.
Now you saw that laser tip I showed you, that needle. Remember that, Pratim?
Yes.
The needle. If
Yes.
you break one of those, you shouldn't be practicing dentistry.
Yeah, they are pretty big.
You know.
Hard to break those.
Did
That
you hear
loop might break though. You had one loop type of tip.
Loops are different because you use one of those needles and then it goes into your sterilizing area and it's cleaned and it's then sterilized and it comes back to where you're going to use it again. It's unlikely it's going to be damaged.
Okay.
What
But
we do is
the loops are more likely to get damaged.
our that very tip, that thing broke. Now what we do is we cut orthodontic wires and then we place it into this every time.
Yeah.
So,
Yeah. Do you know the vari tip, Pratim?
No.
Whenever I try to find something like this, it never appears.
Aldo, do you do Invisalign in your office?
What is that?
Do you do Invisalign?
Yes, yes.
I am doing my own Invisalign. See?
Oh, really?
Yeah, I did my own IPR. I put attachments myself.
Okay.
Let's see how it goes now.
So you get separate IPR strips. It's not available here. I've been trying it.
Yeah,
do you
you
do
can
IPR?
order it from Invisalign website.
Okay. Yeah. So what we do is we have a lab here by the name Dentcare. They make Invisalign, no, Dentcare Invisalign they make. So
Oh,
yeah. So if it's original Invisalign, then we need to send it to US and all. So because the service is very easily accessible, we generally give it to Dentcare.
oh, good.
Yeah.
Okay, Pratim, you see
Yes.
this? This is a Varitip. Can you see the tip where that's coming out of the?
Oh, yeah, now I do. Yes.
Okay. Now you can see the blue part of it,
Yes.
and then there's a part where the electrode is covered, insulated with a clear plastic tube,
Okay.
and then you've got the tip coming out.
Yes.
Okay. Now, if you look at this one, you see it's now being pulled out a bit more.
Yes.
Okay. So what's Eldo is saying that after a while, this becomes a little broken down. You have to cut it off. Okay. And
Okay.
then if you get to the stage where it's been cut off too much, you then put orthodontic wire in.
Oh, okay.
Okay. Pratim, you're using some sort of holder for x-rays, aren't you?
Yes.
Yeah.
We have a full set. Yes.
Okay. Now, Eldo now has an electric motor
Yes.
Oh, wow.
with this handpiece,
Yes.
which
Same.
takes the speed up to 200,000 revs per minute.
Wow. How
Uh,
long do you take for crown prep?
10 minutes or
Wow.
5 minutes. You just cut through. It is not crown preparation. You just cut through an existing bridge. If you want to cut through, just 5 minutes job. Otherwise, it's a real pain to cut through it with a pair of
Yeah.
Wow.
worth an investment. It's so expensive. W&H is very expensive, but the handpiece is quite lightweight than NSK and all that. So I love this. Now I started.
Eldo, on these sessions, I'm banning you to use the word expensive. Okay. You used it before for some reason. If you need something to do a particular job, you need you need it, okay? Pratim, in Germany, they don't use high-speed air rotors.
Yes, you mentioned that
Yeah,
last time.
okay, yeah.
I tried using it for crown preps. I get a feeling that you can reduce the speed definitely by manually, but with the full speed, I still get a feeling that it is just burnishing. It is not actually preparing. But when you use a TC burr to prepare the crown, like how Stuart teaches, then it is a little bit more easy than using a diamond to prepare crown with this so high handpiece, high speed handpiece. It's just my feeling. I've just used it for 2 or 3 crowns.
So
But,
please let Siley in. Siley is trying to join.
What is it, Ashwin?
No, sir. I was just saying Siley was trying to join. Siley.
But Stuart should, educate us more on this, whether it just burnishes the crown, it creates more heat. I don't know. But a lot of water comes. The light is so bright. The moment you put the pedal on, the light comes. And once you stop also, the light still stays for at least 2-3 seconds. So it's a wonderful tool.
Yep.
No doubt. And they say you can do impactions, all this with this, because there is no fear of emphysema coming from this. That's what they say. I don't know. Stuart has to.
So water, air is no. Okay, there's no air. It's not working.
It is not.
With air.
The turbine is not working with air, but water is being pushed with air. I don't know about it. That's what.
Where is the water in this? It goes through the center of it.
Yeah, water comes to the center. It is connected to the compressor.
Right.
The bottled water comes through the spray.
Okay. What's it like? What's it like for removing tooth decay?
So high speed. I don't know. You won't know whether you are drilling through the tooth.
Just 1 second. What is the lowest speed?
Lowest speed is 40,000.
Are you sure?
I'm sure. Because
I thought that electric handpieces could go from very, very slow up to very, very high speed.
that depends upon the handpiece that you use in this. This is 1:40,000. Sorry, 1:5. So even if you use the minimum speed of 40,000, at the tip you're going to get 2 lakh. So if you use a 1:1 handpiece blue ring one, then you'll get 40,000 at the end. So you need to go for a green ring handpiece like implant to reduce the speed lesser than 40,000. That's what I think. No, not evidence-based. It is Koshi's gut-based evidence.
Yes, if you use the implant handpiece, I think it takes it down to 1,000 revs per minute.
What handpiece, sir?
If you use an implant handpiece that's 1 in 18 reduction, it would take it down to about 1,000 revs per minute.
Okay.
Does the speed, Eldo, vary with how? Is it either on or off when you put your foot on the foot control?
No. It's just one speed it gives.
So the answer is yes.
Yes.
My question, Eldo, was.
There's no variation in speed.
Right. Okay. Hmm.
But I think the speed also depends on the torque, right?
On the what?
So 1:5 is the torque on the handpiece, correct?
Oh no, I think the torque is pretty. The difference between high speed and one of these is that the torque is much better with one of these.
I see.
Okay, with high speed, as you know, with the air rotor, the speed goes down a bit when you're actually drilling.
Yes.
Whereas one of these stays the same, I think.
Okay.
What's the benefit, sir? What's the benefit?
It doesn't wobble. Okay. It's a much better fit in the chuck. Okay, there's no in the head of the handpiece, there's no floating turbine, which you have in the high-speed air rotors.
Okay.
Okay, that's why. You haven't seen these trays, have you, Pratim?
No, I haven't.
They're available in America. I'll send you the information where to get them from.
Sure.
These ones you can heat in boiling water and bend them.
So it's mainly for the partial or complete denture cases, correct?
Both. These
Okay.
are the partial ones. These are the denture ones.
Okay.
Okay.
I have those metal ones,
You have,
metal perforated trays.
yeah, okay. Well, these are plastic and you can bend them,
Yeah.
okay, to fit better. Do you use an alginate mixer, Pratim?
No, we had that in school, but I don't have it in my office.
I love them. They're just very, very
Yes.
easy to use. How are you spraying your impressions, Pratim?
We have a disinfectant,
You
but
do?
as a student uses that, I'm not sure which one is it.
Yeah, okay. Tejas was suggesting at least using a dilute bleach solution.
Okay.
Do you spray your trays, your impression trays, Eldo?
No, you just wash it.
Yeah. I think that in the UK that would not be allowed. Okay, you need some disinfectant spray. Do you use something, Ashwin?
Yes, sir.
You do?
Use glutaraldehyde. Yes, I use just glutaraldehyde solution, insecticide N.
Yeah, okay. We had a very funny situation where we were having a meeting here and there was a technician talking and he said, you should not send impressions with blood on them through the post. He said, if I get an impression that's got blood on it, I immediately send it back. And I said to him, in the post? And he said, yes. And everybody fell about laughing. 3% sodium hypochlorite bleach, okay? And you've got, the reason why I put this in here, Pratim, is that some Indian dentists don't use measurers for the alginate
Yeah.
because you have to buy 2 or 3 packets to get the measurer, and they buy it one at a time, so they don't have measurers. I talked to you about do you have one of these, Eldo? You have 2. You don't have one for each room, do you?
One for each room.
That was sarcasm, Ashwin.
So he replied also sarcastically. So
you notice how you use this. You stretch it up against the nasal spine, and then you raise up the lower part like that, and then you look at the measurement for vertical dimension.
Do you know the name of this? We had found out the name for this once. I forgot.
You what?
Willis
The
gauge.
name of this instrument.
Will it?
No, sorry, he's a Willis gauge. That's what he said.
Miller's. He had found this out once.
Willis. That's what Sir said, right?
Is it WH or WI?
I'm not
Willis, correct.
It is.
Correct. I agree. Correct.
Right. How are you getting on with rubber dam, Ashwin?
Yes, I'm doing good.
Good.
Mm.
Okay. Pratim, what do you use rubber dam for?
Only for endos. And sometimes for like major veneer work or things like that.
Yeah. I told you I used it for all fillings.
Wow. And then how many patients did you see per day?
About 12, 15, 12.
Wow, you're fast.
How many patients do you see a day?
About 8 patients of my own and 8 hygiene patients for exam.
Dear, yeah.
I had a case recently. It was lower 7 right quadrant, and it was a class 5 preparation, and 6 was missing. Wisdom tooth was not there. I tried placing. I couldn't use the rubber dam. I mean, I don't know. Because to get that class 5 was pretty, we're pretty close to the gums. And so I thought I'll try placing the clamp on 5 or 4 and then probably do a floss tie around 7. But didn't work out. It was too messy. And I just removed it and started filling it normally.
Okay, now, it was a cavity down at the gum line.
Yes.
How do you remove the gum?
How do I remove the gum? I don't have a cautery. Sometimes I use.
Just 1 second. Just 1 second.
No, I didn't remove.
Just 1 second.
Yeah.
We don't use cautery anymore in dentistry.
Electrosurgery.
Yes. Okay. So how do you don't remove the gum?
No, I didn't remove in this case, but some situations I. And I don't have a. I mean, what I probably, especially if it's a filling interdentally, a class 2 filling, and probably the gums are at a higher level, I kind of heat I have a long-ended instrument, so I heat that instrument and remove that excess tissue.
It's the red hot poker technique. Yeah.
Whatever it is. Yeah.
Now, with that patient, you having difficulty with the rubber dam. If you'd been able to take the gum away, would it have made it easier for you?
No, sir, because still it won't be easy because the clamp will
Go into the
obstruct
cavity.
my way.
Yeah,
It
okay,
won't
well,
go
I mean,
into the cavity, but the wings and everything will be an obstruction.
yeah, you'd have to photograph the case next time and ask me, okay? Siley, have you got one of these rubber dam stamps yet? Are you there, Siley? Have you sent one to her, Eldo?
I don't remember. I don't know. I think I sent to Ashwin only. I don't exactly remember.
Sally, are you there? Okay. You can have these made quite easily, can you, Eldo?
Can you repeat that?
Can you, you can get these made quite easily, can you?
Yes, yes, that I can make it very easily.
Okay. Do you have any spare ones at the moment?
What did you say?
Do you have any spare ones at the moment?
Or maybe 4 or 5, I suppose.
You do, okay.
Yeah.
We need to check. Do you use rubber dam, Anand? No? Okay. Ashwin, have you solved the problem of the ink with your stamp?
No, sir, I still use the marker pens. That's how I do it.
Oh, that's historic, that really is.
I mean, I use the other one, but you know, it still spreads out. The ink spreads out.
Ashwin, you have a stamp, don't you? Elder, you have a stamp and you've got a pad for putting the stamp onto.
Yes, I have.
And Ashwin says that when he stamps
hear
the
me?
rubber dam he's using, the ink flows.
Stuart, am I audible? Hello?
So that
Yeah.
that depends
Hi.
upon the kind of ink pad that is using.
Ashwin, you need to really work out what ink you're using because you should be using the stamp. Siley, do you have a rubber dam stamp at the moment?
Please excuse me for a moment.
Siley, can you hear me?
You don't hear me. I was trying to ask. You can. Hello?
Siley, do you have a rubber
Hello?
dam stamp?
Can you hear me now?
Yes.
No, I don't have a rubber dam stamp yet.
You
I'll
need to
get it from Eldo. I'll
get
message.
one from Eldo, okay?
Yes, I will.
Pratim, you still with us?
Yes.
You only need these clamps. The number 1, the number 8A, and this one. The more clamps you have, the less likely you are to use them,
Yes.
okay? Have you had time to look at my system for applying rubber dam yet?
Me? No.
Oh, sometime, okay.
Okay.
Do you use these burrs? This is the most common
Yes.
burr I use.
Yeah, I love
556.
it.
Yep, okay. I'll tell you something, Pratim. After I'd been retired from doing clinical dentistry, and I went into my treatment room, which is just next to where I am at the moment, and I picked up one of these after about a year, and I looked at it and I thought, my God, that's small. You know, your concentration has to be amazing, and as a dentist. And then when you stop doing clinical dentistry, you haven't got the same mental concentration to realize how to use a thing like this. Do you use these, Pratim?
Yes.
330? You do?
Yes.
Okay. These are the routine burrs for amalgam, composites. Okay.
Yes.
Do you use a half round?
Sometimes to give the, what is it called? Retention groove.
That's it. Yes. Okay. Do you remember the inverted cones?
Yes.
Do you use those?
No, they give a lot of undercut. So now everybody is saying don't use inverted cones.
Well,
They
that's what.
undermine the cusp significantly.
Okay.
And
Anyway,
especially for composites, right? You don't need that much undercut.
not always. It's only when the buckle composite falls out 3 or 4 times do you think, I think I'll put a bit of retention in.
Okay.
Do you have some of these, Pratim? Long flame diamond?
Yes, I have that, but I think we use that for crown prep. For
Yes.
composite finishing, we use the one with the yellow or red stripe, the finishing burrs.
Hold on a minute. Oh, for God's sake. I can't let Ashwin in. Do you have some of these?
Yes.
Yep. Okay. On one side of these, you don't need. It's my opinion, Pratim, that most dentists use twice as many different types of burrs than they need, if not more than twice. That
That's
only makes things complicated. This is the only flat end tapered diamond you need. I'm just letting Ashwin in. You have this burr, I'm sure. Have you tried to get hold of any of these, Aldo? Aldo's not with us. And these diamonds, this one for adjusting acrylic in the mouth, temporary crowns or dentures. And these burrs, 2468, for taking decay out of teeth. And then the this is a chemical for cleaning burrs. Do you have something like this, Ashwin?
Yes, I do.
Yeah. these magnetic burr blocks are fantastic. They can, if you're doing a crown preparation, the assistant can put the burrs you need in a row, all ready to use. Smoothing composites. Pratim, we were talking about using different burrs.
Right.
If you've got these burrs anyway, why do you need special composite finishing burrs?
It's very, these ones don't smoothen the composite that well, do they?
Yes, perfectly. Yeah.
Oh,
Well, this one, you use the diamond burr, this rough diamond burr for any gross removal. And then you
okay.
use the tungsten carbide, 12-sided, either the flame or the bud. And then you might use some polishing paste for composite
Okay.
or discs. Crown preparation burrs. Sometime if you look at my crown preparation presentations, you'll see that we start off by using this burr, then we go on to this burr, and then we put the bevel in if you're doing a beveled crown, and then the 12-sided to smooth the bevel. Did you try getting hold of any of these, Pratim?
No, I didn't get chance. I will do that.
End
We only
cutting,
place order once a month,
oh, yeah.
but yeah, I'll look into that.
Anant, have you got any end cutting diamond burrs? Can you unmute, Anant?
No, sir, I'm not having this burr.
Oh, you need to get hold of some, and Eldo can tell you which ones to get. Okay.
Where do I get the carbide one?
So say it again.
The one used for bevel. I just need that. Where do I get the 7901? The carbide burr.
The
for
12-sided.
smoothing.
Do you buy
Yes.
these? Oh. Eldo, can you spare a minute? Are they not in your catalog?
No, I don't have many carbide options, I think, but I'll just look for them. If someone in the group knows, Ashwin, Mani doesn't have these, right?
Mani doesn't have, I've never seen this one, but the 345 burr has, I mean the 5561 that sir is showing is very similar to our 345 burr. And
Okay.
the one that he's showing 255 is also there with Mani. But the
Yeah,
7901 I
think-
have not seen.
Yeah.
Eldo, do you have the 12-sided tungsten carbide burrs?
Those, when I came to UK, you gave it to me. Otherwise, I have not bought it from you.
Have you looked for them?
No.
I don't know how people work. Sadie, try and find some,
Yeah.
okay?
Okay, I will.
Pratim had to leave, sir. She has a doctor's appointment. She's left.
Who is that?
Can you
What's that, Eldo?
Sorry.
Yeah, I wish to see that 3-4 slides before the 2 slides before the amalgam plugger just caught my attention. Go back, go back, go back.
These?
No. I just. Yeah, this one. The handpiece. Yeah, so this is a red ring that you're using and green rubber point.
Yeah.
Yeah. This is for polishing metal
Yes.
and ceramic.
And ceramic, but you could use your handpiece. That's what is the speed increasing on your handpiece?
1:5, the same one.
Same one. You can use that.
Yeah.
But not at 200. You can't vary the speed on your electric handpiece. On your motor.
No, I cannot bring it down lesser than 40,000, lesser than 22 lakh, because it is 1:5 handpiece. The minimum is for 40,000, so I'll be getting 2 lakh.
Just one moment. Hi there, can I call you back? Okay, I'll call you back a bit later, okay? Bye. The motor, the highest speed of the motor is 40,000, isn't it? Eldo?
I think I was thinking that the minimum speed is 40,000. I don't know.
Well, if the minimum speed is 40,000 and you've got a 1 in 5.
Let me see, just a second.
No, 40,000 is the maximum.
That should be 40,000 should be the maximum.
You're using this sort of thing, are you? Oh, is Pratim still with us? No.
Now, can you see that plus sign there? So that means that you can increase it. 40,000. Oh, I don't know. Probably 40,000 is the maximum.
Can you find out and let us know?
Yeah, I'll
Okay?
find it out tomorrow. Yeah.
Yep. Have you got these sort of things now, Sally?
Yes.
Yeah, good.
You mean the Palodent, right? Matrix.
The Garrison or any of those.
I mean, the installation there for last.
Yeah.
How is it using these sectional matrices? I haven't started using them.
You're using them, are you, Sally?
Yeah, I'm asking
You're
Sally.
asking
Yeah,
me?
Sally. Yeah.
I've been using it like 4-5 years now. I used to use the old Palodent first, and now
Hello.
I've switched to V3.
Okay, how is it? I mean, how is it? What is the advantage?
Okay, I'll talk to you again in a few minutes. Okay, I'll call
Very,
you back.
Over
very
TOEFL, Maya?
easy.
Thanks, cheers.
It's very easy to adapt and comfortable for the patient also. But the bands are very thin, so you really get good tight contact.
Okay,
It's
so you're the
far
whole thing
superior to
you're using.
Topilmere.
Okay, so you're using the
It's a
whole thing.
one-time
Palodent's made.
Yeah. I have the kit.
Palodent's retainer, bands, wedges, everything Palodent's, or you're using it differently?
Yes, everything. No, everything Palodent.
Okay.
So it causes that separation. The ring causes separation. And
Yeah,
the bands
yeah.
are really thin and adaptable. So you get very good contact.
Fine.
And I'm using that SDR flow from Dentsply also.
What is that?
In the it's a smart dentin replacement. So it lines the base of the cavity very well. It adapts to the matrix and to the walls of the cavity very well. So you get good flush margins on the X-ray. It's a flowable. You have a gun. I'll send you the photo. You get compuse of that composite. It's flowable, but you can bulk cure it. You don't need to go on increments. You can fill the proximal box completely with that SDR.
Oh, SDR, SDR. You said SDR, no?
Yeah.
Okay, fine. Thanks.
So you can get this. You can get this from Dencare. These articulating paper. Okay, they sell the Bausch articulating paper. When you're doing a butt margin and you use this burr, you need one of these chisels. You don't have one of these, do you? Do you use a chisel, Eldo?
No.
No.
Fortunately, psychologically, you're better off not using unwaxed floss to check the margins of your crowns, because then you don't know how well or how badly they fit. Also, if you don't have one of these, you don't know about the sharp bits of enamel crystals that you come across when you use one of these. When you
What's this called, sir?
Enamel chisel.
Safident chisel. It's a chisel. Okay. And as you scrape it round, you can feel the crystals breaking off. You can get these from Spain. You can get everything you want if you're persistent and you want it. Okay, if you say that I can't get one of these chisels from Spain, that's pathetic. Okay, it is possible if you go about it. Okay. Also, this Fisher Packer, the smaller size. What do you pack your cord with, Ashwin, Eldo?
I have Fisher cord packer.
You do. There you are. Okay. Where did you get it from?
One from you, one from some of the conferences.
Okay, so it's always possible to get everything you want. Do you have crown removers?
Yes.
Yep. Siley?
Yes.
Yeah. Shade guides. Occlude spray. Do you have this, Ashwin?
No, sir, I don't have a glue spray.
How do you check contact points?
I use I use articulating foil.
Yeah, okay. This so much easier, but you know, all in good time.
Yes.
Being prosthodontist, you'd have one of these, wouldn't you, to do your glazing? This is a non-vacuum. Okay. It was about, I don't know. These are not very expensive compared with the vacuum machines. So I would add on some porcelain and then glaze it. Or if it's a gold crown, I would use this solder to add a contact on. I use these to measure the width of teeth. And I've talked to you about these. Since I started using this local anesthetic syringe, I would not want to use any other. It would frighten me. The fact that the needle is protected like this, it stopped any needle stick injury with that sleeve. What are you using for complete mouth, for complete denture impression material? Siley? Are you there, Siley?
I use rubber base for final impression and impression compound for, yeah, can you hear me?
Yes, what
Hello?
do you use?
Impression compound for primary impression and rubber base for final.
I haven't used impression compound for dentures for 20 or 30 years, I should think.
Oh.
But
Have you?
that is one of the best material for impressioning in complete dentures, according to me. You know, it's a thermoplastic material and it gives all the advantage of that. No other material is as good as impression compound.
Impression compound?
Yes.
What's wrong with
time?
What's wrong with just taking an alginate impression?
There's no working time. You won't get good margins with the alginate impression.
But you're not getting your margins. With your first impression, you're not getting margins.
But first impression should be the best impression. And then you work out on that. Now you cannot argue with me on this. I'm a prosthodontist.
Elder, that is absolute and utter rubbish, okay? What you're trying to do with your first impression to get a model on which you can make a tray. Okay?
You know,
and then you're going to green stick the tray. So the first impression is not important at all.
No. I don't agree to it. You have to work more if you don't get the first impression right. You can extend it till Hamler notch, whatever you don't require, you can cut it off, keep that region alone. You can remold it. Impression compound is the ultimate thing. And it is disposable, just one cake for one patient.
Eldo, once you've got your first impression and you're having a tray made, the tray is spaced, okay, so that there's enough room for the impression material by about 1.5 millimeters or 2 millimeters. It's not even close to the model. And then you're going to green stick all the way around the tray before you take your zinc oxide Nugenol impression or silicone impression. So the first impression is not the most accurate one. The second one
No,
is.
no. You won't space the whole thing. You just make a, it's a kind of mushroom spacer. If at all we are giving, you give a mushroom kind of spacer.
Although
So that relieves only the mid-palatal pathway and the root gate. No, you cannot argue and win over me on this.
I give up, Eldo. I give up. If this is the ridge, your tray is going to be like this. And then you put green stick on and muscle mold to get the margin. Okay, that's when you get the accuracy.
Sir, even the compressibility of the tissues also matters. So different stresses on the tissue. So alginate won't exert much stress on those areas of the tissue where
compression,
where it can be compressed.
The compression has got nothing to do with it in the first impression. It may be in the second impression. Okay, that's when you get the real impression. Okay, you don't want all the alginate impression is doing is supplying you with a model to make a tray to fit on. Okay. Now the other thing is that if we move on to your final impression, I still prefer zinc oxide Nugenol because you can add on to it more easily. If you take a silicone impression, how can you add on to it? You can't, can you?
And also silicone is hydrophobic. It is zinc oxide or a non-eugenol impression paste. It is still hydrophilic. That is one of the best.
Why should I worry about whether it's hydrophilic or not hydrophilic?
And as you said, you can add more. If you use a thin light body, you cannot add, exactly add more on that.
Okay, thank you. You put a scientific into reason for what I was talking about. Ashwin, you have some zinc oxide Nugenol impression material, do you?
Yes, I do. I use zinc oxide. Yeah, I use green stick and zinc oxide.
Okay, and is that going to work for hinge records?
Yes, I use it, but the material is not so good. The one that I'm using right now. It's the paste is good, but the way they deliver it is horrible. I mean, you can't even just squeeze it out of the tube. So I'm looking for some other materials.
If you can, as soon as you can find something, let me know because I need it for an occlusion course when I come over, okay?
Yes, okay.
So let me know, okay? Okay. Do you use orange solvent?
I don't have that. No, I've not even heard of this. Orange solvent is for root canals, I've heard, but never for this.
When you're cleaning zinc oxide and Nugenol off instruments,
okay,
what would you use?
You put Vaseline and clean it up.
Strangely,
Spirit cleans it too, right? Spirit.
well, okay. The strange thing is that when I'm running courses and I'm taking the hinge records using zinc oxide and Nugenol, I sometimes get some on my trousers.
Yeah.
Do you know how I get it off?
No, tell us.
Vaseline.
Fascinating.
Yeah, unbelievable. Vaseline on some gauze gets it off. Okay. Are any of you using the patient's dentures to take the impressions in?
Are any of you using?
Patients' dentures to make impressions. I've made a note of it. I haven't had a patient.
How many dentures do you make a year, Sally?
I make very rarely.
Yeah.
One or two.
Yeah. I would say that in the last 30 or more years, out of all the times that I used first impressions and second impressions was extremely rare. I was always using the patient's dentures. So much easier. And then when you clean it off the dentures, you use this orange solvent. You don't have orange solvent in India, do you, Eldo?
No, I've never heard of this.
You know, I have something called as friginol. I get a solvent with it for cementing temporary caps. It's eugenol-free temporary cement, friginol.
Yeah.
So there is an orange solvent with it. I think
There
it's
is.
the same one.
Yeah, yeah.
And one more curious thing about UK is now presently dentists don't do dentures. It is denturist who does dentures in UK.
I don't know whether that's true or not.
Yeah, it's true. You know, every junction you see denturist shop, denturist, you know, board with denturist working 24 hours and all. So I asked somebody what this denturist means. And then they said it is no more dentists do any dentures. It is only denturists who are allowed to do dentures there. So strange for us.
Have you got pumice? You've got pumice, haven't you, Ashwin?
I do. Yes.
And have you got the soap as well? Polishing cake?
Polishing cake? Not yet.
Was that next year?
Next month, sir. This month.
Right. And what about these? Have you found a source for these?
Polishing wheel? No, not yet.
I sent you all this. didn't I?
Anybody's using this?
Sorry?
No, I'm asking, sir,
I
if anybody was.
like 3-4 dealers. I'm trying
Eldo,
to
you
get
use this, don't you,
hold
Eldo?
of these.
Eldo, you use one of these, don't you?
I think so. The boy has it.
You don't know what he does?
So many things we have bought to him. I'm not sure whether he has this with him.
God's sake.
So this is a goat hair brush. Goat hair.
Okay.
And you also need one of these, Ashwin.
Because I don't have this. I'm not using this. I have this one, yes. Soft cloth buff. I have
Yeah.
this.
Okay. And it goes in your straight handpiece.
Yes.
Okay. Do you have,
It's very good. I mean, it's very easy to use this one. So
do you have denture fixative?
yes.
Yep. Wax knife. These are wonderful.
Yes.
Do you have any of these, Eldo?
Not exactly this, but we have different other models.
With a scalpel blade that fits on?
No.
These are much better.
Yeah.
How do you sharpen yours?
You don't sharpen it. You just throw it off like this.
Okay, now you've done your green sticking when you were when you're ready, Elder.
Yeah, you can carry on. Just spare me 10 minutes. I'll come back.
Okay, when you're making your green stick, your denture or your tray for a complete dentures, you muscle mold it all the way around. You're then going to take off 1.5 millimeters to 2 millimeters for the impression material. How do you cut it? The green stick?
Sharp.
With BP handle.
Sorry?
BP handle.
What blade?
Number 15.
15.
Yeah. This is the size you need. Okay. I think it's a 27. I'll check. But the 15A is the wrong shape. It's not big enough.
I mean, you can use even 11, I guess. 11.
You could use 11, yes. Yeah, that would be better. Oh, there we are, 25. But this handle is where the blade fits on is bigger. So if you could get a lab handle and get these number 25 blades. And do you have paper like this? When you're
Paper?
adjusting dentures?
No.
We're still trying to find this suck down material. Ashwin, you haven't found it exactly yet, have you?
So the spacer thickness is not precise there. The rest is fine. It's got a spacer, but the spacer thickness is exactly not mentioned. They've only said it is very thin inclusion or whatever, some term they used, some spacer, but it's very thin, but they have not mentioned the thickness in the website.
Right.
Only the diameter of the sheet and the thickness of the sheet. That's 1.5 is also available, and 125 millimeter diameter. They've given.
So are your suck down machines round or square?
I don't have a machine, so I'm not. I mean, I don't know what the lab people are using. Not sure.
Yeah. But Ashwin, when you do ask for a suck down shell, You need to be it's definitely saying you want a spacer in it.
Yes, absolutely. I mean,
Difficult to find a spacer. I
Say it
can't
again?
find them. Nobody. It's so difficult to find someone using the spacer. Nobody seems to have it in Pune.
see, I mean, if they don't have a spacer, how will the retainers actually fit? It's such a struggle to fit the retainers, no? I mean, I don't think they will be using one without a spacer. I don't know because if they're using without a spacer, then it's going to really be difficult removing the retainers, no?
So
No,
they
the model.
normally come with a sticker over the.
Yeah.
Is that the spacer or is there something
Yeah, that should be.
separate? I think that's the spacer.
Yeah, that should be the spacer. I mean, I'm not very sure, but because without a spacer, just imagine if we just place acrylic on top of the teeth and try to take it out.
I don't see
I
what.
bought one.
What were you just saying then? Say it again, Ashwin.
No, I'm saying, sir, I'm sure they will be, the lab people, I think they are unaware of it because it should be included with a spacer. Because otherwise these night guards and retainers after orthodontic treatment, it will be very difficult for the patient to remove from the mouth. So.
No, that's not true, Ashwin. Ashwin, that is not true.
Yeah.
It's just it's more uncomfortable when you put it in. Okay, I've made them with and without. And you can take them in, put them in and take them out. That's not the problem. The problem is that they're just a bit too tight and they're uncomfortable. Siley, you check with your labs because they probably do
I
have
called many labs.
And none of them talk about a spacer.
No, they just say that they have the 1.5 sheet. None of them have heard about the spacer. And I told
which
you,
brand,
right,
which brand are they using?
I had sent Stuart the photo. Just a minute, I'll just check and tell you. Yeah, EasyVac or something.
Bought from Vijay.
EasyVac.
Once they had the sticker stuck over the template. I thought it was not necessary. I peeled it off and then I made a vacuum splint in college.
Oh, okay. So I think that should be the spacer, right? That should be the spacer.
Now only I realized that I might have been a spacer. I was wondering what is it sticker for? I thought for to prevent the scratching or something, they just stuck it.
Do you know where to get them? I don't mind buying the sheet and then getting the
Where's she going to buy it from,
lab.
Ashwin?
So liberal traders.
Okay, they come with the spacer, you mean? 1.
Yeah, that model, no, that model that is in Durand Plus.
Yeah.
Is inclusive of the sticker, which I think it is the spacer. So the Durand plain one does not have that sticker with it. Yeah.
Okay.
So Durand Plus 1.5 millimeter and 125 millimeter diameter. So they have not individually mentioned the thickness of the spacer.
You ought to ask them to leave the spacer in. And then when you tear it out, do you tear it out yourself, Ashwin?
No, sir. I mean, I don't have a machine, sir. They make it for me. The lab people. I mean, no, we don't tear. I mean, I don't tear anything out. It's not possible. First of all, it's like they give it in that night guard shape, and the hardly you can't remove anything from there.
Do you ask them if they've teared it out? If they've
no, I
torn
haven't,
it out?
sir. No, I haven't asked them.
So you need to check
can
with
check.
them if they've torn it out, because if they
I'll
aren't
check
tearing
it.
it out,
Yeah.
okay. Can you check? Can you definitely let me know about that, Ashwin? Okay.
Sure, sure.
Stuart, do you think I should buy the vacuum from machine in the clinic?
I don't think you're going to use them enough to make it worthwhile for the moment. Okay. If you've got everything else, yes. Okay. If you've got everything else, yes. But for the time being, I would get them to make it. But it's more important for you to pour models in your clinic.
Yes.
And trimming them so that you can draw lines on the models where you want them. Okay. As I've said before, I would not now work without the InSafe syringe. Have you thought of getting them, Eldo?
No.
I tell you, once you've got this system, I mean, I can't remember either sticking myself with the needle or an assistant doing it for years, ever since I got these. 50% of dentists stick themselves with a needle once a year. Just from a point of view of reducing stress. Siley?
Yeah.
This is more important to get.
Okay.
Okay. Eldo can tell you where to buy them.
Okay.
Use some sort of heat sealer, do you?
Yes.
Yeah. Okay. You enjoy this, don't you, Eldo?
Very much.
Yeah.
I'm thankful.
How expensive or what is the cost?
In India,
I was
they
checking
said it is.
online.
Siley, what was that word you used?
No, she needs to know the comparison.
Expensive.
In India, they quoted 75,000. We bought it from UK.
I couldn't hear. Okay.
And you need these different sizes.
And when you get it, buy only this model which Stuart is showing, because they have a upgraded version dentist, which is not good as this. You have to get this model called the EuroSeal. Latest one is EuroSeal 2000. Don't buy that. Buy this old model. Yeah.
This is gusseted, this one. Can you see down on the edge, which is open? Do you see that it's, do you know gusseted, Siley?
No, what does it mean? No.
On clothes, women's clothes, sometimes the clothes are gusseted. I can't describe it, but can you see on this picture, you see the white paper at the back? You see the white paper?
Yes.
Now on the right there, do you see that it's folded slightly where the opening is?
Yeah.
That's gusseted.
Okay.
Okay, so it opens up.
Okay.
Have you got some of this, Eldo? For putting bigger items in, okay?
I got this one. I got it last time.
You've got some.
Yes.
Can you let Sally know what you got?
Yeah, sure. Yeah.
Okay. Now, when you're sealing it, are you using a sort of kitchen type cheap sealer?
Yes, I'm using that one.
Okay. And the line on the Euroseal is about this far apart. It's that wide. Okay. The one that you're using, Ashwin, probably is only about this wide. Is that right?
Yes.
Yes.
So you need to use it 3 times.
Yeah.
Okay.
Oh,
Use it 3 times.
okay.
I've been in a particular clinic in India, and I just picked up 1 or 2 bags and they just opened up. They weren't sealed. And the people didn't care. Okay. So you need to do it 3 times. Can you see the gusting there on the right? You've got some of those, haven't you, Eldo?
Yes.
Yes.
You do. You see the gusting there, Sally?
Yes.
Okay. You're under. This is the Elman Electrosurgery unit, which I would get. Vacuum autoclave. When I first came over to India, they were using those pressure cooker things. I hate to think if they put a Bowie Dick test in the middle of one of those, probably wouldn't even heat up. Do you have this, Eldo? You got these? Yeah. Ashwin?
No, I don't have this one.
Okay. You got kitchen gloves?
Yes.
Yes.
Yep. Okay. You wouldn't be allowed in England to handle instruments without gloves like this. And you need a container like this to take the instruments from the treatment room to the sterilizing area. Plaster, vibrator, vacuum mixer. You got super glue in the practice routinely?
Yes.
You have, right? Different colored pens, felt pens like this, A4 pads, glue, blue tack, mirror like this, laminator. This is my label printer. it stopped working about 2 weeks ago. And my computer man came in and said, yes, Microsoft has just changed its whatever it is. And he said, a lot of the people that I work for, their printers have stopped working. So it took him about 2 hours to download the new software for this printer. Life's a nightmare. You never know what's going to go wrong next.
Shall we stop?
Yep. Okay. We'll carry on from here next time and go into surgical instruments as well. Okay.
Okay.
Yep. So Eldo, send one of those. Do you have Sally's address?
Shall we send you your address?
I will just right away.
Okay, and Eldo will send you a rubber dam stamp. Okay.
Yes.
And I also need the suction tips, and if you are getting
You send me what all you
if-
require. I'll send you whatever I have. I'll send you.
yeah.
But can you look in some catalogs and see if they sell those suction tips?
No, if and when I buy the dust suction, the tongue guard suction, and the other ones which Eldo got made, I just the tip delay attachment and.
Did I send you
whatever
that?
we can. No, we were talking about those, but I haven't bought the door suction yet. So
Oh, you haven't bought it?
No, I haven't.
That is one best investment that you can make in the
Yes.
clinic. Yeah. I bought
Okay.
a paper slicer recently.
Say it again.
I bought a paper slicer recently.
You got one. You have a paper slicer. Okay. Okay. Whenever I think I've completed this list of things we need, I then add something else onto it. It's a constant upload all the time. You got that thing, Eldo, from me on overdentures?
Yes, I've sent you some replies also. I've not gone through the whole thing. Almost 25-30% I've gone through. I've sent you that. Just check your mail.
Right. Okay. Yeah. Okay. We'll see you again next week, if not before.
Yes.
Okay. Cheers then.
Bye-bye.
Bye.
Thank you. Bye bye.
Bye bye. Bye, Anant.
Bye, sir.